Welcome to Lagos Update on the City of Lagos TV show on TV Nigeria. It's time to keep you abreast with latest news update in and around Lagos. We'll be right back. First on Lagos Update, the Honorable Commissioner for Fiscal Planning and Urban Development, Dr. Oluyinka Olumide, recently announced a one-week stakeholders meeting to discuss key fundamental issues in the building industry at a press conference in Lagos. The stakeholders expected of the engagement span from professionals in the built environment to town planners, architects, estate surveyors, and developers. The commissioner stated the rationale behind the stakeholders' engagement and equally made clarifications on questions raised from the pressman as regards regulatory procedures and requirements with respect to acquiring land and building structures in Lagos State.
The whole idea is for us to sit down together and jointly examine what are the challenges. A lot of people, even the market women, majority of them are not yet aware of the importance of planning permits. So those are the reasons why we decided to engage on this stakeholders meeting for the whole of this week. And there is going to be a lot of other exercises that will come up as a way of going down to the grassroots to let them understand the importance of planning permits. Even ordinary fence, you are expected to have a fencing permit. That is by law, number one. Number two is the fact that in case there is a need for government in future, like expansion of roads, new roads, if that particular building does not have a planning permit, that means it is not recognized by law, in which case compensation might not be possible. Planning permit is also very, very essential, because if, for example, there is a need for you to talk about, let's say you are applying for a visa, or you are applying for a facility from a bank, and there is a need for you to present your landed property, documents for your landed property. If you present such and it does not have a planning permit, it's not going to be accepted, because the meaning is that that development is not recognized by law. It's very, very, very important. Regarding the details for this approval, it is very, very simple. The very first thing you need to do is to marshal your team of consultants. In most cases, they start with the architect, and you submit your survey. Upon the completion of that architectural drawing, that is architectural drawing, you still have other drawings that will be required. In this case, you have the structural engineering drawing, for which a civil engineer will produce that. So having gotten all your drawings together, you now approach the district office, and we have 57 of them all over Lagos, the local government and LCD all over Lagos. So it's not necessarily you come to head office or to the secretariat. You go to your nearest district office. They will give you an assessment that this is what you are expected to pay. You go to your bank of your choice and you make your payment. You will now go back to the district office with the receipt of your payment. What we've seen as a challenge at this point is the fact that, and you will agree with me, you must be a tax-paying citizen. Then you must show your evidence of tax payment. This is what we'll be having, because majority of people who are trying to apply for planning permits are not paying taxes.
And of course, finally on Lagos Updates, the recently held Nigeria State Level ART Impact Survey, Lagos State Press Conference, saw various key strategic stakeholders in attendance, and the occasion was a veritable platform for the Lagos State Ministry of Health, an ample opportunity to brief the media and critical stakeholders about the progress made so far to ensure a successful execution. Representing the Lagos State Ministry of Health was the Permanent Secretary who gave account of the Ministry's strategic master plan to achieve its set objectives.
On behalf of the Lagos State Ministry of Health, I am pleased to brief you on the Nigeria State-Level Antiretroviral Therapy Impact Survey, the AIS, in Lagos State. The survey is a significant health initiative aimed at improving the well-being of the people of Lagos State. The Antiretroviral Impact Survey is designed to assess the effectiveness of the HIV and AIDS response in Lagos State. The data collected will help us understand three key outcomes. One, the number of people living with HIV who have been identified. How many of these identified are receiving life-saving antiretroviral treatment? And then thirdly, among those on treatment, how many have achieved viral suppression? Meaning the amount of HIV in their blood is so low that they cannot transmit the virus to others. It's important to note that the main goal of HIV treatment is to reduce the amount of virus in the body to such a level that it cannot be passed on to other people. The objective of the survey is in twofold: to measure population-based HIV treatment coverage, which involves assessing the proportion of individuals living with HIV who are receiving life-saving antiretroviral therapy, and to determine the prevalence of viral load suppression. This will help us understand the percentage of individuals on HIV treatment who have achieved viral load suppression. In short, the effectiveness of the therapy that we're giving. The data collected will provide valuable insights that will inform our health policies and strategies to enhance HIV testing, treatment, and care services in Lagos State. The ART survey will provide information on the current levels of treatment coverage and viral load suppression and help identify gaps and areas that need improvement. The survey will help in identifying systemic challenges and opportunities for strengthening our health systems to better support individuals living with HIV. The survey will help us to understand biobehavioral patterns and factors associated with HIV virus suppression in people living with HIV who are on ART to strengthen support services. How will this survey be implemented? The survey will be conducted between October and December 2025. During the survey, only males and females who are between the ages of 15 to 64 years will be interviewed. The survey will be conducted in about 6,150 households across all the 20 LGAs in the state, during which approximately 11,354 people will be interviewed. Our trained field teams, comprised of healthcare professionals, will visit households to collect information through interviews. The teams will offer HIV counseling and testing with rapid test kits, and the test results will be provided before the team leaves the house. We assure you that all data collection and analysis will be done with the utmost respect for the privacy of all participants. Information collected during the interview will be kept confidential, and anyone who tests positive for the first time during this activity will also be referred to care. Community engagement. Community mobilization and engagement are key components of this survey. We have been working closely with community leaders, civil society organizations, and other stakeholders to ensure that our communities are well informed about the service objectives and benefits it will bring to our people. We encourage all residents to participate in the survey if asked. However, we respect your decision if you choose not to be a part of this. If you agree to participate, it will take approximately 45 minutes for the interview and the blood sample collection for HIV testing. The ART Impact Survey is supported by our partners, including the Federal Government of Nigeria, Federal Ministry of Health and Social Welfare, the United States President's Emergency Plan for AIDS Relief, PEPFAR, Public Health Information Surveillance Solution Systems, FIS3, and various subject matter experts.
And that's a wrap on Lagos Update this week. Do care to join us on the City of Lagos TV show for more news update on Lagos Update.